Bad breath can be the cause of a lot of anxiety and even embarrassment. Hi, I'm Dr. Promila Mehan, and in this video today, I'd like to teach you how to get rid of bad breath. And when it comes to bad breath, it's equally important to understand the causes and the treatment. So let's start with some causes of bad breath. The biggest cause of bad breath is poor oral hygiene. With poor oral hygiene, you can develop gingivitis, which is inflammation of the gums. That can progress to periodontitis or periodontal disease, which is infection of the supporting structures of your teeth. And poor oral hygiene can also cause cavities. Another cause of bad breath can be dry mouth. Now that's a really big topic. There are quite a few causes for bad breath and for dry mouth, and there's a lot you can do to help alleviate a dry mouth. So I'm actually going to spend an entire video talking about that in particular. Some other causes of bad breath can be the foods that you eat. Garlic, onions, coffee breath, those are the most common ones. And also some serious medical conditions such as untreated diabetes, kidney disease, liver disease, and a variety of other medical conditions. So to treat bad breath, the first thing you want to do, the easiest and the best way to start treating bad breath is this excellent plaque control. Now what that means for everybody is a little bit different. For most people, brushing twice a day and flossing once before you sleep is enough to really control your plaque and to control your bad breath. But if that's not enough for you, during your dental hygiene appointments, we'll find a system that works for you. You may be somebody who will benefit from brushing and flossing twice a day, flossing in the morning and evenings. You may need to brush a third time a day. We may want to recommend an electric brush. We might want to change your toothpaste. There's a variety of different things we can do, and we will work with you to help you find a system that works best for you. Dental cleanings, professional cleanings. Once your plaque hardens and calcifies and turns into tartar, you actually can't remove that with your toothbrush. And that's where you need to come in for professional dental cleanings on a regular basis. We remove the plaque, we remove the tartar, we scale, we detoxify the root surfaces and make your mouth nice and healthy. Your dental cleanings are really important. And with your checkups, we'll find if you have any cavities. Now, a couple of cavities, 2, 3, 4 cavities really will not create bad breath at all. But if you have a mouthful of cavities, that definitely is going to create bad breath. The bacteria that live on our enamel surfaces are different than the bacteria that live underneath your gums, and they're different. The ones that live underneath the fillings, the one that cause cavities. If you've ever flossed, just as an experiment, you want to just smell the floss after you've flossed all your mouth. The floss smells really bad. So those bacteria really do contribute to bad breath. So oral hygiene, dental appointments, dental cleanings are really important. I will talk about dry mouth in another video. I'll talk a lot about the causes and the treatments of dry mouth. And if it's a medical condition, sometimes in a routine dental appointment, we actually will discover that there are some issues going on that you may be unaware of, and seeking advice from your doctor is the way to go for that one. I want to share a little story about a patient that I had a little while ago. I had an 84-year-old man come to me as a new patient. His son took me to the side and he said, Dad is great, but he has really bad breath. He said, if there's anything you can do to help him with that, I'd really appreciate it, because we've all noticed that Dad's sort of avoiding social events. He doesn't really come out to a lot of family events anymore. So I said, sure, I'd be happy to see what I can do to help him. When I met the gentleman, I asked him, do you have any concerns? And he said, nope, I'm fine. I have no pain. I brush twice a day my whole life. I don't floss. I hate flossing. Don't tell me to floss. I'm not going to do that. But I've noticed I got a bit of bad breath, and embarrasses me a little bit. If there's any toothpaste or mouthwash you can recommend, that's really all that I want today. So the ground rules are set, no flossing, just he wants some toothpaste and mouthwash, and I said, okay, let's take a look. So I asked him a little bit about his medical history, and he apparently had a serious medical event a couple of years ago, and he's on a bunch of different medications. So he did comment also that he's drinking like a gallon of water every day because his mouth feels so dry. So sure enough, when I looked in his mouth, he had a very, very dry mouth. He had plaque and tartar everywhere. He had gingivitis. He had periodontal disease, and he had a mouthful of cavities. Unfortunately for him, every single tooth in his mouth had a filling, and every single one of those fillings were decayed or broken down. So it wasn't a simple case of recommending a toothpaste or a mouthwash. He needed more work. So I explained everything to him. We worked with him. He was a real trooper. He came in. It took us about 3 months. We removed all of the old fillings. We replaced them with good sealed new fillings. We cleaned his teeth. We taught him good oral care at home. We didn't do the flossing because he made it very clear he wasn't going to floss. We recommended a water pick for him. Got rid of all the decay, got rid of the gingival inflammation, managed his periodontal disease, and you know what? We got rid of his bad breath. At his next free care appointment, his son came in with him, and he came to me and he said, you know what? He goes, it is so great to have our dad back. He's smiling, he's laughing, he's a life of all of our family events, and he's making everybody laugh with all of his crazy jokes again. What a great story. I was so happy to hear that. Thanks for watching this video, everyone. Please subscribe to this YouTube channel for more oral care tips and learning how to keep your breath smelling fresh.